Hi, I'm John Green.
I'm Aaron Carroll.
And we're here today to do Healthcare Triage Q&A. I'm going to ask your questions of Dr. Carroll. I also might ask some of my questions, most of which will revolve around my own mortality. Aaron, am I going to die?
Yes, someday. Not now.
What's my chances next 5 years?
Very, very low. Really low.
Yeah, but not nil.
Not zero, but not yet. Really low.
We're going to start with a question from Little Lion Flower. How long does it take to process food into stored fat or muscle or energy? Like if I eat fewer calories today, will I see the difference tomorrow or the next day?
Not in terms of fat. So there's no chance that fewer calories today is going to reduce in like a fat reduction tomorrow. But there will be changes in your water weight, and actually like eating less salt or eating less certain nutrients may make you diurese or pee off some more, that you might see an immediate rate reduction, but it won't be a fat reduction that will be consistent.
So if I'm looking to lose 13 pounds in the next 24 hours, what would you recommend?
I don't know if there's any way, short of like, amputating a leg, that you could probably pull that off. Or have a baby. Women can do that. Have a baby.
So I just need to have a baby.
Have a baby. Tomorrow.
Sikowski, possibly Sikowski, asks, do you think there are specific health benefits to weight training?
Well, certainly if it gets you to exercise, then the answer would be yes. Because of course, in fact, some of the recommendations for exercise are either 150 minutes a week or like 5 days a week, or 30 a moderate, or vigorous for 2 30-minute periods, and then I think 3 other periods of weight training. Like you can do that instead. So if you want to figure it out so that you're still getting the recommended amount, weight training is perfectly fine. Some people also argue too that if you put on more muscle mass, that helps increase your metabolic rate or how many calories you're burning, and it can help for long-term weight management. I'm not totally convinced of that.
What about the supposed cognitive benefits of weight training?
So again, I think that's more exercise than it is weight training. So that there are definitely cognitive benefits with respect to anxiety and depression and everything else, and I think we even discussed this in an episode of exercise, but I don't think that would specifically be weight training.
So I'm good to continue with my 30 minutes a day of jogging / fast walking.
That's 30 minutes a day, 5 days a week. Of that, you have done the recommended amounts.
James asks, my parents are saying Obamacare has caused their premiums to rise, but I'm not convinced that's the reason. They're in Texas. What a surprise. What causes premiums to rise? How can I help find them better rates and plans? Can I answer this question first?
Sure, go ahead.
And then you tell me if I'm right. No, Obamacare has not caused your parents' premiums to go up. And the way to find them better rates or plans is to have a drastic overhaul of our healthcare system so that we have one that's more like countries in Europe.
Okay, since that's not going to happen, I'm going to give you realistic advice. So it's like, first of all, premiums go up when healthcare spending goes up. As much as we demonize private insurance companies, their profit margins are on the thin side. So what happens is they have to guess each year about how much they're going to spend on healthcare. If they wind up spending more on their risk pool than they thought, then the next year they raise the premiums in order to sort of compensate for that. So the reason the premiums went up likely for your parents is that health insurance company wound up spending more money than they did the year before. The way to fix it is, if they're getting a plan from the exchanges, go shop for a cheaper plan. It's very likely if that plan went way up, then other plans may be cheaper because they weren't covering such a sick pool. So you need to shop around every year. It is easy, however, and common these days to scapegoat Obamacare and just blame it for every little problem. Healthcare spending and premiums have been rising really fast forever. And in fact, in the last few years, they've been rising much more slowly than ever before. You can also credit that to Obamacare, but nobody does. But these days it's like anything. It's like, did you hear drugs have side effects? Now it's because of Obamacare. This is not all Obamacare's fault.
Is there any truth to the talk that Obamacare is in a so-called death spiral where the pools are getting sicker and sicker?
No. So what they've seen is that some of the co-ops have gone under, and those were specifically some nonprofits that they tried to hold together. And it turns out it's hard to start up a health insurance plan from scratch, especially if it's small, because when you cover a very small risk pool, it's dangerous. You've also heard about some companies saying that they might, and it's might, exit the exchanges, but those companies have a rather small share of the entire private insurance market, and the exchanges, they don't comprise the big players. And those people are hanging in, and there's nothing about it which isn't a death spiral or ending.
This question's from Janine, who asks, what does current research say about eggs? My grandparents' generation were told that eggs were bad because of cholesterol. My mother was told not to eat egg substitutes. What is being told to my generation?
That eggs are fine. And we even have a whole Healthcare Triage episode on this topic. You should go watch it. But the gist of it is that most people are what we would call hyporesponders to dietary cholesterol. That the amount of cholesterol that they eat does not have any real relationship to their serum cholesterol or what's in their blood. The vast majority of your cholesterol is made by your liver, and it's not what you're eating, and the eating doesn't matter. They've done studies where they give people with diabetes like 3 eggs a day, every day for months, no impact whatsoever. So it turns out dietary cholesterol, not really related to serum cholesterol. So the idea that we need to watch how much cholesterol we're eating is sort of out of vogue.
All right, Aaron, Little Trip to Heaven asks, pros and cons of donating my eggs. I don't think she's referring to chicken eggs.
I hope not.
In which case, I think it's all pros, except that, they don't keep that well if you
eggs are
donate them to a
delicious.
food
You
pantry.
give them away.
I think it's great. We're in favor of it.
Yes.
But
yes.
when it comes to the eggs that are inside of one's body.
So the cons are that there are some potential downsides. You can have ovarian hyperstimulation. You can have an infection or an abscess. The long-term outcomes aren't really well known. There's pain, obviously. Some women might react to the hormones. So there are some downsides. The upsides are sometimes you're helping somebody out, so there's that benefit. And a lot of people often do it, unfortunately, because there's a lot of money in it. And so, unfortunately, sometimes the companies that are into this prey on students and younger women who really do need money, and then it gets questionable because we're talking about a lot of money involved. And so, you should really talk about that with your doctor, and you should really think about whether it's worth it for you. If you're helping out somebody that you love, of course, there's a real upside, and even helping out somebody you don't know, there could be a real upside too.
Michelle asks, I've been getting a lot of conflicting info about Lyme disease, some of it from different doctors, chronic Lyme versus post-treatment Lyme syndrome, ideal length of antibiotic treatment, etc. What's the deal?
So, you get bitten by certain types of ticks. They give you Lyme disease. First thing you do is you get a localized rash. And usually it's like it gets red, it gets indurated, and sometimes you wind up getting sort of a bullseye around it. Sometimes it's just sort of like diffusely red all the way out. Later that will start to spread, and you'll start getting that rash in other parts of your body. That's like this delayed infection. And any time during this, you want to treat it with antibiotics and you can take care of it. The first reactions are easy to treat with like oral antibiotics. As it gets more spread, they're going to use IV antibiotics. If you don't get the infection in time, it sort of goes into chronic mode. And then you wind up having some pretty severe problems that can be neurologic, that can be muscular, that can be joint related, and they can last for a long time. And some percentage of people get that. At that point, antibiotics don't do much. People think it's almost too late, which is why you want to really catch Lyme disease as early as possible.
Hannah asks, is there a difference in hand cleanliness? Oh, near and dear to my heart, Hannah. This is one of my favorite kinds of questions. What's the best way to wash my hands? If you use soap before wetting your hands.
Yeah, ironically enough,
Fascinating.
People worry about the soap far too much. The biggest and most important part of hand cleanliness is that you have water and that you literally are using a lot of contact and scrubbing. That is much more important than the type of soap you use, when you put the soap on, or how much soap you use. It is the scrubbing under the water. So, I don't know, put the soap on before, put the soap on after. I would put it on, to be honest, after, because it's really important. Don't forget the water and the scrubbing, that's what makes a difference.
All right, follow-up question. If I am in a situation where I don't have any Purell and I don't have access to water, does this do anything?
Not between your two hands because you're rubbing it on yourself, but technically I think if you took a towel and you rubbed, like something that was clean, and you rubbed, you would likely be taking off some of the dirt.
Can I just rub it on?
Probably no, because I bet your shirt is dirt. Anything that's on your
even
hands.
dirtier.
That's the thing. It's like you need something clean. That's why the water theoretically is cleaner than you. But if you just rub your hands together, all you're doing is rubbing stuff from one hand to the
I was
other.
kind of hoping that I was killing the bacteria with the force of my hands.
No, and in fact, there have been some studies out that show that the paper towels are probably better than the hand dryers, because first of all, the hand dryers inside are often filthy, and so they're just blowing germs onto you. But when you take the paper towel, the actual rubbing again takes some stuff off of you.
The Purple Man-Eater asks, I know that a causal link between knuckle cracking and arthritis has been disproved, but do these results also apply to other joints that people can crack, like their necks and ankles and wrists?
No, you're fine with all of it. It doesn't do anything. Although it can make you like socially unacceptable, it might not make people not like you, but it doesn't matter. You know that when you crack it, what you're hearing is actually the gas boiling out of your joints, because you're creating a vacuum, and then like the gas can actually theoretically boil. So, I don't know. It's really unpleasant for a lot of people, but it's not going to hurt you.
Amanda asks, what are your thoughts on the mixed research or lack of research on helmeting babies for plagiocephaly?
You got it. Plagiocephaly. Plagiocephaly is when like one half of the back of your head is flat, and brachycephaly was when both halves are flat.
Okay.
Since we've done sort of the back to sleep campaigns with babies now, and if you don't pick them up and they spend a lot of times, you get more and more flat. There are a lot of people that think you need to put those kids in helmets, like really rigid helmets that like make their heads grow into them. It's incredibly unpleasant. It can be expensive. Where I trained, they did a lot of this and they developed it and they swore by it. There's no good evidence that this stuff works. And the only randomized controlled trial that I know has been done was published in the BMJ. It showed no difference. It's like 26% of kids in helmets had fully resolved, 23% of kids who never got the helmets fully resolved. This is like, most of us, we have no idea if our heads are flat in the back or not, because your hair grows in and you grow up. So it's like, I don't know.
Sarah asks, is yoga or a form of cardio better for managing anxiety?
Oh,
I've got a good answer to this
Go
question.
for it.
As somebody who does a lot of anxiety, but not a lot of either cardio or yoga. Just whatever works for you is better, and you can do both. Like do your own randomized control trial, and then whatever works for you.
Yoga gives me anxiety, so I can't endorse it.
I feel so. The reason I feel anxious when I do yoga is because I'm usually in a classroom setting, and there are lots of people around me who are better at yoga. So it's essentially like asking me to go to a calculus class, but where I have to publicly perform calculus.
I think it's almost even worse. So it's like they're speaking another language because I don't even know what they say a word and they all know what to do, and I'm like, I don't even know what the person just said.
Yeah.
I can't do any of it.
And
it hurts.
Even when I know what it is, it's hard. But I'll tell you what. Lots of people swear by yoga.
I know, I'm not
and
trying to
they
swear
are probably right.
Yes.
Ethan asks, is the U.S. treating MCR1 containing bacteria, I don't even know what that is, Ethan, now I'm nervous, as a serious threat? And if not, should they be? What is that, Aaron? Is it a serious threat?
I know I shouldn't answer this question because it's only going to make your day really bad.
It is a serious threat.
It's like a bacteria which has been picked up more and more in other countries. I think it's been in China, maybe in Denmark recently, and it's a bacteria that's pretty much resistant to every antibiotic we have. So it's not terribly common yet, but people are starting to get panicked about it.
Should we be panicked about it? Because I feel like the bacteria that are completely drug resistant have a better chance of spreading through human populations, almost by definition.
But again, you're talking about a few isolated incidents. It's like, Ebola is terrible too, but it's not, it's mostly contained. It's not here. And so you could spend the rest of your life panicked about stuff that's overseas that could kill you, and it absolutely exists, and we should work on trying to combat it, but it's probably not worth a lot of everyone's brain power all of the time.
You told me not to worry about Ebola. I didn't worry about Ebola.
It turned out fine.
I didn't get Ebola.
Right.
Yet.
No, you're not going to get Ebola.
I didn't get it yet.
You're not going to get Ebola.
Well, I mean, I'll tell you what, if I get Ebola,
I
want to hear you say...
I will publicly apologize to you on tape if you get Ebola.
On tape. Notice he didn't say in person.
On tape.
Yenmano asks, what is the evidence for implementing nurse practitioners as primary care? Are the outcomes different from family physicians?
No, the outcomes are not different. Of course, my wife Amy is a nurse practitioner, so I'm biased in this answer. But no, they're phenomenal. She's a much better primary care healthcare provider than I am. Any day of the week. Certainly providing primary care for specific tests, I think they're excellent, and we use them in many parts of the healthcare system. A lot of times, regulations are fought by the AMA and other groups that want to, of course, keep the market small so that there are more demand, but there's no evidence that they provide inferior care in any way.
Okay, this question is from Andrew Hart, who asks, are sugar substitutes safe to consume in high amounts, like 10 to 15 packets per day, equivalent to 2 tablespoons of sugar according to the packet?
So if we're going by science, ironically enough, and this is going to scare a lot of you, that's not considered high use. If you look at sort of what the FDA says is the maximal amount that they know or they believe is safe for a lifetime of use, I think for aspartame, it's the equivalent of like 75 packets a day. So if you used more than 75 packets a day every day, that would be where they would say you're out of the safety zone. For saccharin, it's less. I think it's like just under 25. But still
a lot.
like that's a ton. And 10 to 15 is way less than that. Now, if you're asking me as like, on a personal level, that's 10 to 15 seems like a lot. Like I think anything in that amount is probably too much. I have maybe like one or 2 packets a day in my coffee. Some people still think that's crazy and that they're unsafe, but we did a whole episode on artificial sweeteners. You can go watch that. But still, like even at that level, that's still not considered unsafe.
So the FDA basically thinks I can have 40 Coke Zeros a day.
Is that the aspartame or is that Ace K? I can't remember these days.
I think
Coke Zero is still aspartame. Yeah.
No. Coke Zero is not aspartame. Diet Coke is aspartame. Coke Zero is the
Ace
other
K.
one.
I think Ace K is, if I remember correctly, Ace K is, well, it's at least 25 because I know saccharin's the lowest.
All right.
I think Ace K is at 75 with aspartame. So yeah, you're still fine.
Really hard for me.
40 is a lot
to
though.
drink a case of Coke
But that's
Zero
only
a day.
24. So
I know.
it's like you're still fine. That's a lot of soda. I wouldn't drink that much.
Thanks. Thank you for that advice that I shouldn't drink 40,
I wouldn't.
40 sodas a day.
I don't think I should drink 24 a day. I don't know. I'm going to go way less.
Mike Hutchings asks, will you do a video on SSRIs? How effective are they? How common are they? Are they suitable for children and teenagers? Side effects,
Yeah, in fact, our last Healthcare Triage Live, we said we're doing that video. We'll do it in probably February, because I think January is already pretty much written. But that's a great answer. SSRIs is sort of controversial still how much they actually do work. So we'll do an episode on that.
Aaron, this is our last question for today. Joey Karp asks, is drinking out of disposable plastic water bottles bad for your health?
No. It's probably, we've said this before, it's probably not great for the environment.
Right.
So, no, it's not great for the environment. I'm not even going to say probably. Not great for the environment.
Yeah.
But if you have one and you're using it over and over and over again, unless there's something really wrong with it, no. I mean, a lot of the stuff you hear about leaking out and microwave and all, it's overblown and it's not real. The amounts that you have to get are huge, and you really just can't get it from plastic water bottles. So for the most part, no, it's not dangerous to you.
It's only a public health concern
Yes.
because it's bad for the public.
Which also long-term is bad for you. So,
Right.
so yeah, limit it. But it's like, but don't freak out that if you drink like a glass or a bottled water that you're going to get sick. It's not going to happen.
Well, Aaron, thank you for introducing me to the new super-resistant bacteria that I didn't know about, and for answering all of our questions.
And Lyme disease. Don't forget about
Oh
Lyme
yeah, Lyme disease. Thanks.
disease. Anytime. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associate, Joe Sevitz, and our Surgeon Admiral, Sam. Thanks, Joe. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.